If you get your Zepbound medication through LillyDirect, you may be already aware that there is a new option for a Kwik-Pen, which has multiple doses of Zepbound in one single pen. This is a new option where previously LillyDirect only provided Zepbound through single-use vials. And I'm really excited to review this new pen option because this pen gives us a lot of flexibility. And I've been, using this pen with many of my patients and having really great results. So I want to share with you, and you can bring back this option to your physician or healthcare provider to see if it is right for you. If you are listening to this on a podcast platform, this is a talk that I highly recommend you check out on YouTube. My YouTube channel is Metabolic Health with Dr. Lindsay Ogle. I have the link below because I'm going to show you on a demo pen how to use Zepbound multi-dose pen, the Kwik-Pen. And so it would be very helpful to see this in video format on YouTube. So please check that out for this video. But hopefully if you, are an audio learner, listener, then you still get something out of the podcast, but having the video would be very helpful for this talk. If you don't know, my name is Dr. Lindsay Ogle, and I'm a board-certified obesity medicine physician, and I see patients in Missouri through my telehealth practice, Missouri Metabolic Health. And if you live in Missouri, I would love to see you as a new patient. You can join through the link below, MissouriMetabolicHealth.com. Or if you live in a different state, then please follow me, and I will continue to share knowledge with you. Of course, this is not medical advice. This is general medical, clinical knowledge that you can learn from and take back to your doctor for specific advice for what is best for you. But today we're talking about this Zepbound Kwik-Pen. I have a sample demo pen here. So this is not the real pen. There's no medication in this. But I wanted to share this with you because this pen is very different than the Zepbound pen that you get if you get your medication at the pharmacy. So this is Zepbound single-use pens. So these pens are meant to be used once a week. There's one dose of medication in these pens from the pharmacy. And then this pen, there are 4 doses of medication in here. So there's multiple doses in one pen. So instead of getting 4 pens for a monthly prescription, you get 1 pen for your month prescription. And for right now, these pens are not available at local pharmacies. This is only through LillyDirect. And I'll include a link below for their website so you can learn more about LillyDirect. But each pen will have a designated dose. So there is the starting dose pen, which is 2.5. And then there is the 5 milligram pen. There's a 7.5, a 10 milligram, a 12.5, and a 15 milligram pen. And so there are 6 pens that have those 6 different strengths. And so, for example, if you were prescribed for your first month a 2.5 milligram pen, that one pen is going to have 4 doses of 2.5 milligrams in it. And then the following month, if you're increased to the 5 milligram pen, that 5 milligram pen is going to have 4 doses of 5 milligrams in it. And then so on and so forth up to the 15 milligram pen, which has 4 doses of 15 milligrams. And so it's the same amount of fluid in each pen, but this concentration of medication is different. And that's how they're able to do different strength pens with the same size pen. So the way to give yourself this medication is, like I said, different obviously than the single dose pen. And I'm going to include a link for Lily's instructions on how to use the pen, but I'm going to go over it a little bit here as well. So when you get your pen, you'll take the cap off, and then you will, in the real pen, there will be a window. Actually, I don't know if it's here or here, but you will see the fluid with the medication, and you want to make sure that it is, clear or very, very light. And then you would want to clean the top with an alcohol swab, and then you'll put your needle on. You'll twist it on. These are single-use needles, so you use them one time for each injection. And I will include a link for how to buy additional needles if you need them, ones that will fit this pen. So after you have your needle on, you're going to want to prime your pen. And to do this, you just turn the knob until the pointer is at this long line. So it was previously at 0, and then you're going to want to turn it to that long line. So it's about 2 turns. And then you will hold your pen up. And again, this would have the needle on it if it was a real pen. And you just hold it there for about 5 seconds. And then you should see the line go back to the 0. And then after about 5 seconds, you let it go. And that's how you prime your pen. You should see a small drop of medication come out of that needle. That's expected. That is right. Then your pen is working correctly. To then prepare your pen for your medication, you need to, again, twist the knob, but you're going to twist it all the way, and then it starts to kind of come out like this, like a ribbon. Until you get 1. And all of the pens will say 1. No matter what dose the pen is, you'll know what your pen strength is. It'll say it on the label. So you're going to always want to check that to make sure you're given the right pen. But it's going to say 1 on here. And then you've, gotten the spring ready to give yourself the injection. And then you'll hold it against your injection site, somewhere on your stomach, your thigh, upper arm. I'll just hold it against my hand. Again, there's no needle here. And then you'll hold it there, and then you will press the end of the pen, and then it'll give you your medication that way. And then it should go back to the 0 because you've given yourself your weekly injection. And then once you've given yourself the injection, you'll want to take that single-use needle off, put it in a sharps container, and then you would put the cap back on, and you can put it back in the refrigerator to keep, refrigerated. Or if you want to keep your pen at room temperature, that is absolutely fine. You just want to use it within 30 days. After 30 days, it may decrease the efficacy of the medication. It does not make it dangerous. It just may not be as effective as if it were kept in the refrigerator. But very importantly, you do not want it to go between room temperature and refrigerated. Once it gets to room temperature, it should stay there, and then it should never be frozen. That will also make the medication ineffective. So what, other than having a single pen compared to single-use vials and getting 4 vials and drawing up the medication and giving yourself the injection that way, there are a few other benefits of this pen. One is that it gives us more flexibility in how we give the medication. So this allows us to do what we call split dosing. So if you are somebody who tends to have maybe a lot of side effects or a lot of appetite suppression the day, 2 days, maybe 3 days after your injection, but then towards the end of the week, you are having a lot of food noise again, your hunger is up, you're not as full, and you're just, waiting till you can give yourself that next injection and really struggling, you may ask your doctor if it's right for you to do split dosing. And what that would be if you were on the, let's say, 10 milligram dose of Zepbound, you would take 5 milligrams on one day, and then 3 to 4 days later, take another 5 milligrams. So you're splitting your weekly dose into 2 doses. Now, of course, this has not been studied. This is not what Lilly recommends doing, but this is done in clinical practice and something that may be an option. So how do you do that? With these pens, as you saw in the demo, you are twisting and there are clicks that are happening. You can see those little dashes that are, that are noted as you're making that, twisting the cap. So to do a half dose of your strength, you would count the clicks for halfway to that 1 that's indicated. And there are 60 clicks until you get to 1 dose. So to do your half dose, if you're doing a split dosing throughout the week, you would want to count to 30 clicks. And a really great tip is that you can take a marker or a pen and you can count those 30 clicks once and then make a mark there. And then for your future doses, you don't have to carefully count each click. You just turn the dial to that mark that you made previously. And what is also really nice with these pens, if you overshoot it, you can dial it back and go back to a previous mark with the pen. So it dials both ways. You can go this way and you can go that way. And so that would be how you would do the split dosing. And say this was halfway through. Same thing as I said before with giving yourself the dose. You would just hold that against your skin, hold the medication against your skin and then press the button and it would give you that amount of medication and then you're done. And it takes you back to the 0. So you can give yourself your dose when you're due next. So split dosing is a wonderful option. Another thing that can be very, very helpful for patients who are using Lilly Direct and paying out of pocket for their Zepbound is that if your doctor is comfortable doing this, they could prescribe a higher strength pen than you are taking. And this is something that needs to be done very carefully and again in constant communication with your prescriber. So an easy example again would be the 10 milligram pen could be prescribed to somebody who is only taking 5 milligrams a week. You could again turn the dial to 30 clicks or notches and then give the 5 milligram dose, which is half of that prescribed strength, weekly. And the benefit of that is that pen, which was created to last 4 weeks, would now last 8 weeks, which can save people money each month. And over time, it could save hundreds and thousands of dollars, depending on what strength you're on for maintenance. And the most extreme example would be somebody who is on 2.5 milligrams weekly for their Zepbound. If they were prescribed the 15 milligram pen and they dialed only to the 2.5 equivalent, which would be 10 clicks, that pen would now last them 6 months instead of just 4 weeks. And it would be the equivalent of $75 a month. So having this multi-dose pen, having the flexibility of doing split dosing and adjusting the dose can really help to individualize obesity care and make it more affordable for many people. Another thing it makes me think of are people who probably would do better at an in-between dose. This is a little bit more technical and definitely needs to be planned with your doctor. And so for anybody who is curious about this approach, I have a chart that I'm going to share here as well as link to, so you can have access to what that might look like. And again, talk to your doctor about this. Obviously, they're going to be the one prescribing you the pen. And so you need to be on the same page of what the prescription is going to be and how you're going to dose yourself each week or twice a week if you're doing the split dosing. So I'm curious, is this something that you are doing already with your doctor? Is it something that you're interested in? Are there any clarifying questions? If you're on YouTube, please comment below or send me an email, support@MissouriMetabolicHealth.com. Follow me and reach out to me on TikTok or Instagram, Dr. Lindsay Ogle, and I would be happy to help on your journey. Again, none of this is direct medical advice. I'm just sharing information that I have learned as an obesity medicine physician and through my practice, Missouri Metabolic Health, with treating my patients. So I hope you learned something that'll help either yourself or a loved one. And I can't wait to talk again next week. Take care.